we really were looking at this cohort because in the past, no other researcher had looked into the diet aspect of the study. This cohort specifically looks into diet, lifestyle, and cancer risk. So there had been previous research done on alcohol intake and then BMI and activity. So we were really looking to see if there was any diet quality relationship between cancer risks. Previous studies in the EPIC Oxford cohort and in the Nurses Health study showed potential risk with diet quality. The way we looked at it was not in specific food groups, but more so overall dietary patterns. So there's these specific dietary quality indices that various people have developed that look at different things. We looked at 3 of them. One of them is Healthy Eating Index, which is based off of the USDA dietary guidelines. So it compares an individual's intake to how well they're meeting the guidelines. Similarly, there's an aMED score, which is based on the Mediterranean dietary pattern, which a lot of research has shown benefits with adhering closer to a Mediterranean diet with various comorbidities that we know are linked to potentially myeloma and other health conditions like diabetes, which also has correlation with myeloma risk. So that aMED score is looking at total intake compared to the Mediterranean diet score. And then lastly, we looked at the plant-based dietary index. This one was specifically interesting because in the EPIC Oxford cohort, they looked at vegetarian and vegan eaters and compared their risk and showed that they had a lower risk of developing myeloma. So, and then in a larger picture, we also are doing dietary interventions in a whole food plant-based diet to see if it reduces disease progression. So with those dietary scores, essentially you can compare dietary intake, and a higher score means a higher diet quality. There's a few things we did to better control for this. We removed possible confounders. We also removed and adjusted for BMI, age, education, gender. And then in addition to that, we also used a residual method for adjusting for energy intake, which is important when using these type of large cohorts, because as I'm sure you know, everyone eats differently and somebody's body size, activity level affects their energy intake. So it's a way to adjust for somebody having a higher energy intake and potentially having a higher intake of a food group and taking that into consideration. So everything is judged on the same wavelength. We also removed outliers of energy intake. So those who were eating extremely high or low caloric intakes. And then what we found is that significantly the HPDI, which is the Healthy Plant-Based Dietary Index, had a significant association with reduced risk of myeloma. So the reason we used Healthy Plant-Based Eating Index is that it gives a higher positive score to healthy plant foods. So things like beans, fruits, vegetables, vegetable oils, tea, coffee, that sort of thing. And then it gives a reverse score to unhealthy plant-based foods such as highly saturated fat-based foods, sweets, sugar-sweetened beverages. And then it also gives a reverse score for animal intake. The researchers who developed this score, Satya at Harvard, actually based this off of the Nurses Health study and based it off of food group data that was associated with increased disease risk and comorbid conditions. But with that being said, so essentially we found that the HPDI was most significant. HEI and aMED were not significant with myeloma risk. Plant-based diets are higher in fiber, higher in these phytonutrients. Interestingly enough, as a dietitian, I talk about fiber pretty much every day with the patient or a person asking me for dietary advice. And I don't know the exact statistics. I think it's 5% of men and 9 or 10% of women meet their dietary goals. So there's this huge fiber gap in the population, specifically in the American population. So I think a lot of this significant that we found in the healthy plant-based diet might have to do with the increased fiber intake and just increased plant intake in general. Patients can be hopeful in, taking these results and paving the way for future studies to get more concrete answers. But I think it's very helpful for patients to know that diet does play a role in overall cancer risk and myeloma risk, and that even if they potentially move a little bit in the right direction, it can make a difference in outcomes.